picture of the QR code. You can take a picture of the QR code, or you can go to this website, www.menti.com, and enter the code that's shown here, and just let us know what country you're coming from. So we'll just wait a few more minutes while everyone joins. Thank you. And so hello, everyone who's just joined the meeting. We're just doing a short icebreaker. So if you don't mind, take a minute, use the instructions on the screen to just let us know which country you're coming from today. Thank you. We'll get started in just 1 more minute. So hello again, everyone. More and more people are joining the meeting. Just to get us started, as many of you are already doing, you can use the chat, or you can go to this icebreaker link on Menti. You can use your phone and take a picture of this QR code, or you can go to the website www.menti.com and enter the code here. And we're just asking which country you're coming from today. I see many of you are already putting that in the chat as well, and that's perfectly fine as well. And this is the results so far. You can see where people are joining from today. While people are continuing to join the meeting, to introduce myself, my name is Amit Mistry, and I work at the National Institutes of Health. And I'm here with my colleague, Francis Agama from the DSI Africa Coordinating Center, University of Cape Town. And we're very excited to welcome you to the third networking exchange that we've organized as part of this program. We're going to tell you a bit more about the event, how it's organized in just a minute. But for now, for the people who are just joining, take a minute, let us know which country you are coming from, either in the chat or in the Mentimeter poll that's shown here on the screen. And we'll jump back into our presentation in just a moment. Right, well, thank you again, everyone, for joining today. We're really excited to have a group of more than 200 people, and we're expecting more to join throughout the event. So I'll get back to this introductory presentation. Again, Amit Mistry is my name from the National Institutes of Health. I'm here with Francis Agama at the DSI Africa Coordinating Center at the University of Cape Town. And we're delighted to welcome you to the third networking exchange as a part of our program. If you haven't been to one of these events before, just to let you know that this networking exchange is meant to be a very informal opportunity for you to learn about different activities happening across the continent of Africa related to data science and health. And it's also an opportunity for you to network and meet people you might want to collaborate with in the future. So that's what today's event is about. It's meant to be informal. It's meant to be an opportunity to network and learn about what other exciting things that are happening. Today's event is not specifically focused on the DSI Africa program, but we do hope to have an event in the future where you can learn more about the different activities that are happening within the NIH-funded DSI Africa program. So for today's event, I'm going to briefly review the agenda. And basically, after this welcome and overview, you'll hear a little bit about DSI Africa, not in depth, but a general overview from Michelle Skelton and Samir Panji. And then we'll move into 3 networking rounds. So the first networking round, you'll have an option of choosing 5 different breakout rooms, and you'll get to meet with a variety of organizations that are working in this space. Then we'll move into a second round. Similarly, there'll be 4 breakout rooms that you can choose from. And then we'll move into a third round, which is focused on funding organizations. And for this last round, we'll all be in the same plenary room together. And then we aim to wrap up around 4:45 Central Africa time. So that's a bit about the event and the structure for today. And just a few reminders, all of your microphones are currently muted because we have such a large group with us today, but you will be able to unmute yourself when we move to breakouts. And I did want to mention that since you have to choose between different rooms, all the breakouts will be recorded and they'll be available on the DSI Africa Coordinating Center YouTube channel in the coming weeks. So you can view a session that you may not have been able to join directly. And if you're interested in learning more about the different organizations, that are presenting today, they've all shared some material, videos, slides, documents. They're all available on the DSI Africa website. So I encourage you to take a look at that website during and after today's event. And finally, if you have any technical issues, please contact Francis or myself in the Zoom chat or by email. As you know, these meetings are sometimes things don't work as well as we hope. So appreciate your patience if you are having any difficulty. And I'll briefly mention some of the if you're a social media fan or user, some of the hashtags and accounts are listed here as well. So with that, I will stop and I'll just hand the floor over to Michelle Skelton and Samir Panji from the DSI Africa Coordinating Center to give you a general overview of the initiative. Thanks.
Awesome. Thanks, Amit. Thanks so much. So another welcome from me. I am the PI on the LYZ Open Data Science platform, but the coordinating center component of this grant. So I'll do an overview of the DSI Africa consortium. So harnessing data science for health discovery and innovation in Africa is one of the largest data science initiatives funded by the NIH on the African continent. The program objectives are to advance data science and related innovations in Africa through the creation of a multi-sectorial and multidisciplinary ecosystem to solve biomedical and public health problems through advances in research. Also to create a pan-continental network with broad academic, public, private, and industry partnerships, enhance African data science capacity, develop new data science collection and analytic systems, applications, and tools, develop advances in policy surrounding ethical issues and law, of course, facilitate resource access to global scientific community, also establish, recognize regional and continental data science centers of excellence, and to enable new interdisciplinary collaborations and new scientific knowledge. It's quite a mouthful. So this organization, we're currently over 300 members, and we've organized ourselves into the following structures. So the coordinating center, which I lead, has 4 other staff members, Rolanda, Francis, Tino, and Tanyan on the call today, facilitating you as well. So we support the day-to-day run of the consortium, logistics, comms, administration. We support the steering committee, which is our governing and decision-making body. We also work very closely with the NIH program staff in this project. And we also part of course, Al-Wazi ODSP Coordinating Center. Professor Nikki Mulder is the lead on the ODSP. We work very closely with the 7 training programs, the 7 research hubs, and the 4 LC projects. And we've also organized 4 working groups. I'll talk a bit about that in a bit. So just the thematic areas that we cover, it's quite a large range, from climate change to social determinants, also disease-specific areas ranging from cervical cancer, eye disease, and we also look at infection dynamics and pathogen surveillance, and also antimicrobial resistance. So this shows where we are situated on the continent, but we would also, of course, like to, the red shows where we're situated on the continent, but we also like to, of course, collaborate with other countries so that we can improve our impact across the continent. And this just shows the 19 countries where we do have a footprint already. So just to dig deeper into the layers of the research hub and how they're structured and what their function is. So they apply data science to develop new solutions for critical health problems. They bring together multidisciplinary expertise, and they also engage government and private sector, as well as NGOs, not just academic institutions. The expected outcomes are to recognize centers of excellence in data science and innovation, to create new knowledge and interventions that have an impact on health, create new products, software and solutions, and also demonstrate that this initiative can improve health on the continent. Okay, then this just shows we have 7 research hubs as well. So this is just a quick look at where these are situated. We can share these infographics with you, updated versions of them. Okay, so the training programs, their function is to train African faculty, train next generation African data scientists, and develop and implement new master's and PhD curriculum. These are the 10 institutes so far involved in this program. They are to also, the outputs are African data scientists trained in state-of-the-art methods and health applications, African institutional capacity to train health and data scientists, and then data science training and educational resources for sustainable impact. In addition to the postgraduate curricula, there are also many of these programs, and I show here the footprint across Africa again, and many of them also provide short courses in data science, online and hybrid formats of that, mentorship programs as well. And I think 5 of these have primary training partners in the US. So we will also share this infographic when we update that. So looking at the ethical, legal, and social impact implications projects, they conduct bioethical and legal and social science analysis of new or emerging data science and innovation issues in Africa. They engage key stakeholders and community members. They also collaborate with the research hubs to explore emerging areas of LC. They are responsible for developing advances in policy on these ethical issues and law, create guidance documents, best practices and new frameworks, but also other resources as well, like websites and so on. And then they also support new interdisciplinary collaborations. And if we just look at the map of where they are, there are 3 primary sites in South Africa and then also 1 in Nigeria, but they also have affiliate countries involved in their projects. So the Open Data Science Platform and Coordinating Center, they are responsible for facilitating working groups and trans-network projects, coordinating communications, of course, scope potential partners is what we're doing today, this whole networking exchange as well, enable discovery of the DSI Africa data sets, access tools and workflows for cross-consortium projects. And the expected outcomes, of course, are new and continental network of scientists, sustainable technology for African data science, and then creating this collaborative ecosystem beyond the funded grantees. So this is just a summary again of our expected outcomes. I'm not going to go through them. We can obviously share with slides with you. And then our working groups, just to touch on this a bit, the working groups are made up of members from the consortium for our data governance. The key focus here is developing a data sharing and governance policy, a common sharing policy for the consortium. Of course, considering cross-border, sharing legal jurisdictions, different guidelines, IRB guidelines in different countries, and existing policies, of course. And then data management there, this working group mostly works with data managers and DMAC leads, looking at data models, which are appropriate for the different data sets from the different projects, and also looking at the data sharing plans. The training and education group is really focused on coordinating the cross-consortium training programs, and activities, looking at needs and gaps, but also developing an introductory course to data science, specifically for the personas, skill sets within the consortium. Another big component here is cataloging the resources coming out of the training and not losing that, of course, and being able to track it on the web. And then also another big component here is supporting the early career scientists, which will be the emerging data scientists of the future. And then our partnerships and outreach group, you've met a few of these folks, Francis, Amit, the importance, of course, outreach, awareness about data science and the importance of data science. These kinds of events we're hosting today, a big part of this group. And the partnerships and outreach group is open to external members. So if you do want to join, I think we can consider that, of course. So this is just a cheat sheet to look at all our statistics. I'm not going to go through it in detail. We can share that with you again, just looking at what we've done so far, the investments made, the different types of projects, the membership, working groups, and so on. So just to these are our contacts, of course, and we will share that. And then just to acknowledge our funders, the NIH, and as I said, we're part of the Awazi ODSP Coordinating Center. So we look forward to interacting with you in the future. And that's from me, and I'll hand over to Samir. Thank you so much.
So Samir, we're not hearing you yet.
Hi, sorry.
Okay,
Just
there
a
you
bit
go.
of technical difficulty. Are my slides showing?
Yes.
Okay, hi everyone. My name is Samir Panji, and I'm part of the Iliwazi Open Data Science Platform, working with Professor Nikki Mulder at the University of Cape Town at South Africa. I'm just going to talk a little bit about the Iliwazi Open Data Science Platform and what we aim to do with it. So Iliwazi, the aim we need to fulfill is to develop an African open data science platform and associated resources to support the DSI Africa Consortium and beyond. And the difficulty about this is you have projects which have multiple partners and multiple data sets, and integrating different data sets, which could be primary data sets, to make them secondary data sets for analysis. And we also need to harmonize these data sets. And in order to turn data into information and knowledge, we need to have different tools and run on those tools and run this analysis and interpret those analysis and make those results available to the scientific community. And we also need to have access and storage and compute, especially because a lot of these involve a lot of informatics techniques such as machine learning, which are really intensively compute heavy. And this solution needs to be feasible in an African context. So that's with Iliwazi, we aim to be a flexible, scalable platform that enables implementation of data science for health that is relevant within the African context and to be used by African researchers. So in terms of Iliwazi, we're 7 partners from Africa, and we have 3 partners in the USA and 1 in the UK. So we're quite a small consortium, and we support the DSI consortium through various mechanisms, such as data. And in terms of data, it could be data harmonization, management, cleaning, mapping to models, and in tools, making software stacks available, developing new workflows and new tools, and containerizing workflows, and customizing computing environment. And then, of course, there's the compute, which we facilitate through on-prem computing, where we provide computational access to the different DSI Africa projects. Or we're trying to also see if there's a pathway that we as African scientists can migrate to using cloud compute as well. and to make the access of cloud computing a lot more easier for the African researchers. And then, of course, we have a strong component of training, which ranges from curriculum development, hosting training workshops, and creating competencies as well. So the existing solution that we're looking at is the data biosphere concept. Within the data biosphere, you have your different data sets that could be sitting in different cloud buckets or in different locations on-prem. You have your data assets, and then you have a digital object catalog, which can be then searched. You have your indexing and searching functions, and then which lead to your scientific portals, and you have your workspaces, your analytical engineers, and your tool repositories, which is all like your application layers. And then you have the top layer, which is your portals where people come in as a point of entry and look and identify data sets. So all of these are built on the Global Alliance for Genomics and Health Standards, J4J standards. So this is what we're looking to try and implement on African infrastructure, computational infrastructures and data stores as well. So this is just an overview architecture of the Iliwazi ODSP. You have the user that comes into the gateway, which is your portal. You have your documentation, your help desks, your public data portals, your training materials, your SOAPs, and also your policies and stuff. The user actually accesses the workspace. They can search the biomedical data catalogs, and they can then take that data and put it into a compute space and do the analysis on it. So in terms of the data, we want the Iliwazian users to develop suitable data models, which we can help them map to, and then harmonize the data to these data models, and make this metadata searchable via catalog. Just to be clear, I mean, just because data is searchable, metadata is searchable by the catalog, doesn't mean that the data itself is openly available. You do have restrictions because it could be health data and it could be identifiable data. So, but what we want to do is put in policies in place that tell you how to apply for access to that data, so to make it easier for the user to gain access to that data. In terms of the tools, we like to have the tools sitting on somewhere like Dockstore or on some portals where you can actually pull those tools into your workspace. And your workspace could be either Terra, or it could be a Jupyter Notebook, or it could be on-prem, or it could be an HPC. And we want to give a beginner and advanced access to these tools as well. So for some users who are more beginner levels, they'll be using more GUI interfaces, while the more advanced users will be looking at using more command line interfaces as well. In terms of the compute, we'd like people to be able to take the data sets of choice and then run the analysis on a compute platform of their choice. In this case, if you're looking at cloud, it would be either Amazon, Azure, or Google Cloud Platform. Or in our case with Iliwazi, we're trying to make it a local OpenStack cloud infrastructure that will be running on Ilifu. The Iliwazi hosting sites are in Mali, South Africa, and in Uganda, and we hope to implement this there. And this is just a picture of what we want to work to, which I did give in a little bit of overview for the user. This is a list of useful links, and please feel free to contact us. And I'd just like to acknowledge all the Iliwazi PIs, the coordinating center, and the funders. Thank you.
Thank you, Samir. Thank you, Michelle. There's one question in the chat probably for Michelle. Just could you share how people outside the DSI Africa consortium, like health scientists, how they can be involved and get involved in some of the activities from DSI Africa? And Michelle, while you're responding, I'll go ahead. Go ahead.
Can you hear me? Yep.
Yes, go ahead.
So thanks so much for that. So we have multiple levels of how you can get involved. We often, when we have face-to-face meetings, we have also networking exchange. So we invite folks to come and present or have poster sessions with us. So that's at one level. And then of course, through the partnerships group, you can join that. And also with individual projects within the organization. So there are multiple ways to get involved, you know, if you have common interests with that group.
Thank you, Michelle. There is another question for Samir. I wonder if you could respond in the chat, just so we can continue with the activities. And for everyone, we're going to now begin the first round of networking. And the way this will work is that you'll, in a minute, you'll be able to choose a breakout room, one of 5 different breakout rooms featuring the different organizations that you see on the screen here. And you'll be able to go in, and when you're in these breakout rooms, you'll hear a very short presentation of around 7 minutes or so from each of these organizations, sort of a flash talk. You'll hear a presentation, we'll go through a few presentations, and then you'll have the rest of the time for Q&A and discussion with those presenters. There will be a facilitator. So if all the facilitators could just briefly turn on your camera here, there will be a facilitator in each of these rooms just to help guide the discussion and keep the discussion moving. We'll have about 45 minutes in this first networking round, and then Francis will close the breakout rooms and bring us back to the plenary for the next round. If you have any, so at this time, choose one of the 5 breakout rooms to move into, and we'll begin the first round. If you have any questions throughout, be sure to just work with the facilitator that will be in the room. So thank you all. And yeah, this time, once again, please feel free to move into the breakout room of your choice, number 1 through 5 on the topics that you see on the screen here.
I am on mute.
Thank you. Sorry. Hi, everyone. Thank you for the session. I'm sorry. I know that some of the groups might have had to end abruptly in the interest of time, but please know that those sessions were recorded and information about each organization is available on the website. We'll share more information on that soon. We're on a short break while we transition to our next round of networking. In this round, we're just asking, feel free to step away from the computer if you need to break. But for those of you who would like to, we'd like to ask you another poll question. And the link is in the chat. You can also use this QR code right here, or go to this website and enter this code that's shown on the screen. We just ask you in just a few words, how would you describe the field of data science for health in Africa? And we'll take just a couple of minutes to let you respond. And while we're doing that, we'll get set up for the next round of breakouts. So please take a minute, complete this survey question, and we'll jump right back into things shortly. And I'll show you in real time what some of you are responding to. The question was, how would you describe the field of data science for health in Africa? Growing, promising, booming, exciting, but also some interesting comments about fragmented, nascent, ripe, uninformed. So I think we see a lot of excitement, but we also see several challenges in these comments as they're coming in. Please continue to add to this, and I will leave this open for another couple of minutes. While we're doing that, Francis, if you wouldn't mind, just let me know when you are ready and I can jump back into the other instructions.
Yep. So I think we have the new breakout rooms set up. So once it's time, we go.
Okay. Well, what I'll do is we'll keep this open if you'd like to continue to add your comments. And I think we'll share these slides, share these results with everyone after the event as well. But a lot of interesting comments here. And what I'll do is just describe the instructions one more time. I think last time there may have been some confusion. I apologize for anyone who had some difficulty. If you go to the bottom of your Zoom toolbar, you might see these 3 dots. You can click on that and find an option for breakout rooms, and that allows you to choose breakout rooms and move into the room of your choice. As you can see, we have 4 rooms in this round: consulting services, AI, healthcare, part 2, medtech, and public health. And you're welcome to choose any of these rooms to go into. You'll go into the room, you'll hear short, around 5 to 7 minute presentations, and then move into some Q&A with a facilitator. So at this time, we'll go ahead and ask you to move into the breakout room of your choice, and we'll be back here in about 45 minutes. Thanks, everyone. Hello, everyone. I hope you had a good discussion in your breakout rooms. Thank you all again for staying with us for the full program today. We're going to be moving into our final round of networking, but before we do that, we're going to take a short break. And I have shown on the screen a poll question. What are the biggest challenges to obtaining research funding in Africa? A very big question. I encourage you all to take a minute, think about the question, and go to menti.com. You can use the code that's shown here to type in, or you can use this QR code, or in a minute, one of my colleagues will put a link in the chat. We encourage you to respond. And while we're taking this short break, my colleague Francis is going to make sure that our presenters for the final round are all made co-hosts, and then we'll get right into the discussion then. So please take a minute and respond to this poll question that you see here. What are the biggest challenges to obtaining research funding in Africa? We'll wait for another minute or two, and then we'll share what we're learning. Okay, we're getting a lot of responses, so I'm gonna show you some of the responses that are coming in. Patient funding, short periods of implementation, lack of capacity, blind selection processes that are not sensitive enough to unbalances between countries, duplication of efforts, lack of mentorship, lack of infrastructure, poor understanding of the local situation and needs, competition, high competition, while there are limited opportunities, one-man science in Africa. Again, shortage of qualified researchers, competing interests, constricted finances, unconscious biases, and classical types of reviews of proposals, finding funders, identifying funders, accessing calls for proposals, very few funding opportunities, political issues, availability of funding, funders not willing to take a chance on new actors, new players, knowledge of the application process, data access, lack of data, lack of up-to-date data. I'm just reading a few examples here, but I'm scrolling down, you can see. Time, preparation, local support, complexity of grant proposals, research silos, complex processes, grantsmanship. A lot of rich information here, and we'd be happy to share these results with the group. Feel free to continue adding. I'm just scrolling through so you can see the different responses, but I won't have time to unfortunately read all of them. Right, so thank you all for responding to the poll. As you can see, there are many different types of challenges to obtaining funding in Africa. And our last session, our last networking round is really focused on funding organizations. And this round will be a little bit different in that we've actually asked all of our panelists to be together with us in the same room. Instead of having everyone split up, we thought there was enough interest in all these different organizations to have everyone together. But as such, we are keeping everyone's microphones muted. If you have questions, we encourage you to use the chat. And what we're going to do for today, the structure, is we're really going to only ask each of these organizations to just give you a very brief overview of their organization, and maybe highlight a few funding opportunities, but just a few minutes, so that we can go through all of them and have plenty of time for Q&A and discussion at the end. I will remind you that all of these organizations are sharing some materials and links to their work on the DSI Africa website, as well as their own websites. So you're welcome to learn more about the organizations after today's panel. But for now, we really want to just give you a snapshot view into some of these organizations and have some time for discussion and Q&A. So to start off, I'm going to ask our first presenter from the Science for Africa Foundation, Caxton Moreira, if you wouldn't mind sharing your video. Thank you. I'm going to stop my share here. You're welcome to take the floor. And please just, if you don't mind, just reintroduce yourself to the group before you begin. And we'll give you about 3 or 4 minutes to go. Go ahead.
Thank you very much, Amit, for the introduction. My name is Caxton Moreira. I represent the Science for Africa Foundation. So just confirming you can see my slides before I start the presentation.
And we can see them in the PowerPoint mode, not the presenter mode.
So let me just quickly.
Oh, it's showing in the maybe you can do the swap view, perhaps that might fix it. Yes, there we go. Go ahead.
Thank you very much. So I represent the Science for Africa Foundation. As I mentioned, we are a Pan-African non-for-profit organization that supports and strengthens and promotes science in Africa. We are based here in Nairobi, and we support all the countries in Africa. And our main goal as an organization is to support African scientists to implement their work. And we do that through addressing the continent's most pressing needs or most pressing challenges that they have come up with or they have outlined. So we do this by generating quality science that solves problems. And how we implement our work is also through use of data and knowledge that has been generated from this program that we fund across the continent to inform decision making. And we want to ensure that as we're doing that, we create an environment where scientists can collaborate and effectively nurture various interdisciplinary expertise. So we are a pretty young organization, implementing over the last around 3 years, but have a lot of experience implementing as an organization and the opportunities that exist, as well as focus on ensuring that I talk about what opportunities exist for collaboration to the individuals that have joined this meeting. So in terms of our focus, we focus on strengthening the entire research ecosystem. So we work in different areas, but specifically through creation of various STI programs, an emphasis of Africa, as I mentioned, and also ensuring that as we implemented the work, then the evidence that we produce is focused on, producing policies that can be used for engagement with African governments, policymakers, as well as individuals who have the power to make decisions and implement impact work. So in terms of our core business, we look at it from 3 ways. Specifically, we focus on agenda setting, where we look at convening experts to provide their views, basically. So we want to ensure that all the work that we are funding and all the work that you are working on represents the views on the ground, and also ensure that the researchers in the continent have a voice in terms of the work that we fund. And through the outputs of this agenda setting, then we look at designing interventions to address the priority areas. So we look at aspects of creating programs, and through our engagements with various funders, then ensure that we mobilize funds to support these programs in the continent. So some of the programs that we've been implementing over the past few years, I don't know if you've had a chance to look at our website, and this will be posted after this meeting, are engaging in different specific areas that you'll be able to see. And it cuts across the basic aspects that we look at implementing in the continent. So the areas that we work in are threefold. That's health sciences, climate science, and agricultural science. And we ensure that as we're implementing these programs, then we look at the whole entire chain from discovery to translation and implementation. And we ensure that as we're implementing this work, then there is some bit of collaboration. So you'll find some programs touching across more than one specific area of work, or some really focused on implementing just one stream of work, but just looking at the specific aspects that I just mentioned in terms of addressing the most pressing challenges or most pressing needs in the continent. So what you're looking at here is a summary of the work that we do, and I'll focus really on this area where we are talking about the thematic areas that we focus on. So across the three areas, health, climate change, and agriculture, we have different focus areas that we've looked at or focused on. So we look at science, innovation, and entrepreneurship, where we support various innovations in the continent, may it be new innovations or innovation that needs to be scaled up. So we have grants around that. We have programs that have been supported around genomics and population consortia, meaning some bit of work around genomic science in the continent. I lead a program called Clinical Research and Trials Community, which focuses on increasing investments in the continent on clinical trials, and also working with industry R&D partnerships to ensure that we have a lot of engagements with the stakeholders in that field. We also have science and public engagement, which focuses on looking at engagement with the public. Science prioritization and policy work, which focuses on utilizing the data that we generate to create a forum for engagement with policy makers. Some work on open research and supporting publications. Health R&D leadership infrastructures, which focuses on leaderships, research leadership programs, as well as infrastructure to support R&D aspects of health in the continent. And finally, looking at strengthening institutional capacities. For example, institutions that conduct research, looking at some of the capacity gaps they may have, using hub and spoke model where we can encourage exchange of capacity as well as engaging with them to ensure that we support them either through funds or through in kind to support these institutions. So briefly moving a gear up, I think I'll talk about three specific programs that are focused on data.
I'm sorry, Caxton, could I ask you to try to wrap up so we can continue? Thank you.
Absolutely. So I'll take 1 minute. So we have three specific programs that I'll talk about very quickly. One is called the Clinical Trials Community, which focuses on increasing investments in the continent of clinical trials. And this is focused on contributing to the data that is more or less not easily findable to increase engagements on clinical trials. And we'll share these slides to show what areas of partnership that we have looking forward. And we're looking forward to engagements on how we can leverage data that was being presented today on clinical trials. Secondly, we have a program called SPEAR that is focused on engagement around using of the data to inform policy, as I mentioned. And what we've received is some funding that we're looking at implementing AI and data science for global governance from an African perspective. So what we're doing is conducting a mapping of what gaps exist in the continent and how do we use the gaps that have been identified to develop programs that can be funded or should be funded based on the gaps identified. And what we're looking at is collaboration around what AI policies exist and how we can identify the gaps collaboratively for those to be highlighted in that program. Last but not least is a program that we are looking at in the horizon that is focused on identifying what capacities exist and what work has been done around research software engineering. And this is a very nascent field, but with a lot of good work that has been done in the continent. So what we're looking at implementing is a five-fold initiative that is focused on creating a community of practice, supporting of infrastructure that supports this research software engineers group, defining incentives that can create this RSC field as a formal career path, looking at skills and training as well as policy work around ensuring that we advocate for the importance of the software, research software engineering, as well as the research process. So I'm happy to take more questions around the few areas that I've talked about, but there's more that we can identify moving forward in terms of collaboration. Thank you very much.
Thank you so much, Caxton. And just we're going to keep moving through our presentations and do questions at the end. To the audience, feel free to use the chat. Caxton as well, feel free to use the chat to take any questions. And if you don't mind stopping your screen share, and I'll ask our next presenter, Bilal Mateen from the Wellcome Trust. The floor is over to you.
Thanks, Amit. Now let's see if I can get this screen sharing right.
We see it in PowerPoint. Yes, it's up.
Woo! I can do my job. Let me go back to the beginning though. A partial fail. Hi all, my name is Bilal Mateen. I am the Senior Manager for Digital Technologies at the Wellcome Trust, which is a very long way of saying that I have the privilege of leading our digital technology investments with a bunch of other brilliant people that I'm now realizing we should have put a picture up of so that you know who everyone is and what they do. But I can add that in afterwards and share it as part of the slide deck, which you'll all have access to. But I'm hoping that many of you are familiar with the Wellcome Trust. For those of you that aren't, we are a large philanthropic foundation that funds science and health research. We're based in London, but we fund globally. And we launched our new strategy about 2 years ago now. So Jeremy Farrar, who is now Deputy CEO and Chief Scientist at the WHO, I think his first official day is Tuesday next week. This was one of his major bits of work in his second and last term as director of the Wellcome Trust, was helping architect this new strategy that identified 4 strategic priorities. The first of which is emerging and escalating infectious diseases. The second is the impacts of climate change on human health. And the third is mental health, underpinned by this 4th arm of discovery research, which is science for the sake of science, curiosity-driven science that has always had a home at Wellcome, and that we were adamant would continue to do so. It's what led to great things like the Human Genome Project and Wellcome Sanger, and we want to continue finding a place for that in the work that we do. So that's the broad summary of the strategy, and on the right-hand side, we've listed out each of the key one-sentence visions for each of the components of the strategy. But I don't want to dwell on that for too long, because as part of that, whilst we don't have a strategy of our own, there is a team called Data for Science and Health, which is where I work, that's focused on supporting trustworthy data science, supporting each of our different strategic priorities and achieving their mission. So it's a cross-cutting division that works through those subject matter priorities, but also thinks about the foundational work that we need to do to make sure that both data sets and digital technologies are being used appropriately. So to give you a little bit of context as to what that means, we break that down into not just what are the tools and data sets that we fund, but thinking about the enabling environment. So is that data diverse enough? Does it represent the communities that we think of as being most vulnerable to the impacts of those health challenges? And similarly, do we have the regulatory environment to make sure that the work that we're funding research into is eventually making it to the bedside? Do we have the governance procedures to make sure that everyone has equal and appropriate access to the information? The civil society and the members of the community that we're trying to support have a seat at the table, and are we engaging them effectively? All the way down to thinking about the talent pipeline and who gets to be involved in this research. Are we making sure that there is a diversity of experience and backgrounds around the table when we develop these tools and technologies? Because we have seen time and time again that the absence of that is often what contributes to critical challenges and issues not being spotted much earlier, and problematic tools and technology making it to both the bedside and to the front lines of, let's say, epidemic outbreak and response. So it looks quite broad, but I promise you that within each of these pillars, we've got lots of interesting work that I'd love to share with you. But what I'm going to do over the next few minutes is, instead of telling you about just our work, is show you how the two intersect. So how does our work sit within those different strategic priorities that I told you make up the strategy as it stands today? I should also add that we made a commitment when we launched the new strategy that we'd spend something close to 16 billion over the next 10 years. And that was the floor that Jeremy saw for our investment in the space. So a non-trivial amount of money. Am I out of time? I've got 1 minute. Jesus Christ, this is not enough time.
I'm sorry.
So I'll keep it very short then. With climate and health, one of the big things we've been thinking about is these are two disparate communities with two different types of data. How do we support the health community make best use of both long-term climate forecasts, but also, really importantly, local meteorological data so that we understand local experience? Because a lot of the global reanalysis products that tell us what's going on with the climate often represent high-income experience better than they do low and middle-income experience. With infectious diseases, a lot of our thinking has been around the governance, around data sharing. How do we help support countries share pathogen genomic information so that we can support the next generation of vaccine development, which we saw is critical during the pandemic. When it comes to things like mental health, it's that longitudinal life course EPI that helps us understand both how mental health conditions arise, resolve, and how we can target interventions as early in that life course as is feasible. And then discovery research is a combination of all of those things, but something that's been top of mind for us is how do we support the infrastructure, the platforms that drive research and not just the research itself, and how do we reward people who are building those tools and technologies that help the rest of the scientific community deliver best-in-class research. And just to bring it all together, you will see lots of calls from Wellcome, lots of opportunities. And the one thing that Grace, who was on the call and a member of the team, and I were very keen to make sure that you all heard was, whilst our calls and funding schemes might not say data science, each and every one of them will have a space for it. So please do read them, reach out to us. There is always a space for best-in-class data and data science related research across the strategy. And our contact details for the team are at the bottom. Don't feel like you have to reach out with us with a question just about funding. We're keen to hear from the community. I think the most interesting conversations are you telling us about the research you've done, because we're always curious and excited to learn from you about where the opportunities are and what you're interested in doing. So please just say hi.
Thank you so much, Bilal. And again, we encourage everyone in the audience and our panelists to use the chat. We'll come back to questions at the end. Let me move to our next presenter from the Chan Zuckerberg Initiative, Ivana Jelic. I'll hand the floor over to you.
Hi, good morning. Well, good afternoon, evening, depending on where you are. Okay, I'm going to try to share my slides. Let's see. Can you see my slides?
Yes.
Perfect. Okay, well, hello, everyone. I'm Ivana Jelic. I'm a computational biology program manager at CZI, and I'm happy to join you today and tell you more about CZI science programs and some of the funding opportunities. And just very briefly, I would like to also remind you and let those of you know that are not familiar with CZI's mission. Our mission is to support science and technology that will enable us to cure, prevent, or manage all diseases by the end of the century. We were founded in 2015 to help solve some of those toughest challenges from eradicating diseases and improving education to addressing needs of our communities. And we are accelerating biomedical science by developing new tools and technologies, supporting open and collaborative models of research, and funding projects that fall within a number of programs that we have within CZI, and specifically within science, we have imaging program, neurodegeneration, challenge network, open science, single cell biology, science in society, and CZ BioHub. Because we don't have as much time, I would encourage you to go and take a look at our website and learn more about different programs. But I will tell you a little bit more about single cell biology program, which is the one that I'm a part of. On the single cell biology program, we want to understand the human biology and diverse diseases at the level of fundamental unit of life, single cell. We want to accelerate single cell biology methods, technologies, and applications. And again, we do that through funding, building, and doing. And so we support generation of assembly and use of healthy single cell references that will help us clarify these cellular disease mechanisms. And then I will tell you a little bit about some of the funding opportunities that are either ongoing or coming up that may be of interest to this audience. So Data Insights program is one of them, and perhaps the most relevant to this group. And so those of you that are familiar with single cell biology field know that the large amounts of data are being generated. And our goal is to build and expand computational biology ecosystem. That will in turn help us gain meaningful insights into biology, and enable technical progress towards subset of some of the analytical challenges that still exist in this space. And so with that in mind, we launched this Data Insights program to fund projects that use existing and open and available accessible data sets in single cell biology to answer some of the questions or address some of the problems, open problems in single cell biology. And you can see some examples here from our cycle 1. Well, actually, these example areas cover all of the cycles. This is a multi-cycle funding mechanism. We just announced recently cycle 2 grantees, and cycle 3 will open later this summer or early fall. And so example areas include meta-analysis of single cell data sets. And so this is integrating multiple data sets that could be of same modalities or multimodal data sets to glean insight into health and disease. Projects that were supported in previous cycles include development of scalable and robust tools and method for data analysis, improving existing tools and standards, as well as developing benchmarking frameworks and infrastructure. In cycle 2, like I said, we just announced 18 new grantees, and they're addressing challenges related to integrating data sets and applying machine learning methods to analysis of these data sets. You can read more about projects. I think I am running out of time, so I'll skip through some of this. This will open in fall of 2023. We do have one RFA that is currently open. That is for measuring metabolism across scales. And so this is to support 2-year collaborative research projects focused on measuring mechanisms of metabolism across organelles and cells. And you can access more details through the link that is included in this slide. When it comes to building, we are building technologies that help scientists do their job more efficiently. I just listed 2 of them here that may be interesting to some of you. So this is Cell by Gene for exploring single cell transcriptomics data sets, and Napari for multidimensional image viewer in Python. We also have, these are just images, so I'm going to skip through this because I'm running out of time, but we have an API that is cell-centered, Python supported, building and data objects for those of you that are familiar, and we are working on our version of it as well that will come soon. But again, you can read more about this API on our GitHub repository, as well as access a Google Colab notebook, where you can directly connect to these data sets and do analysis in the cloud. You can subset some of the data sets and start analysis right there and then. Thank you. Here are some of the links that will kind of provide you more information about what we do, and also feel free to reach out with any questions. Thank you so much.
Thank you, Ivana. And again, I apologize for the short time for all the speakers. I know it's a disservice to all of you, but we want to make sure there's some time for questions. So there are some questions in the chat for you, Ivana. And with that, I'll hand the floor over to Mitch Blazer from the Millennium Challenge Corporation. Over to you, Mitch.
All right, thanks, Amit. I do have to say that following Chan Zuckerberg and the Wellcome Trust at a research discussion is a pretty tough gig. I'm going to go ahead and try to do this without slides. So I'm just going to tell you a little bit about the Millennium Challenge Corporation and our work. My name is Mitch Blazer. I help to lead the digital development team at the Millennium Challenge Corporation. I've worked there for about 8 years. I've been living and working in Africa for 16 years, both in the private sector and in the development space. MCC, for those who don't know, is an independent U.S. government development agency. We have a single mandate, and that is poverty reduction through economic growth. I don't know whose screen we're seeing, but all right, thanks. So MCC, as I said, focuses on economic growth and poverty reduction. We work in countries that have a track record of good governance, of human rights, and investing in people. So we're quite selective about the countries that we work with. We're currently active in 13 countries in Africa. Our major investments are called compacts. They're generally more than $300 million dispersed over a 5-year period. Our process is that we achieve this mandate of economic growth by identifying the binding constraints that are limiting economic growth in a particular country. We work with that country then to invest to unblock those constraints. This often means investments in roads or energy or water, but also sometimes in softer investments such as education or health. In Lesotho, for example, poor health, historically driven by HIV, has been identified as a constraint to economic growth. In order to address this constraint, MCC is providing or will provide funding to the government of Lesotho to invest in forming a renewed primary healthcare system that provides most care as close as possible to the patient's home. This will help to develop the procedures and standards of care for primary health care and ensure the staff are appropriately prepared to provide that patient care. We'll also invest in health system management by district health teams, localizing decisions on resource allocation and ensuring a closer connection between the need for care and the services that are available. Finally, in Lesotho, we'll implement a digital health system such that a shared patient record is established and updated at each point of service, with particular attention, of course, to data protection. We anticipate opportunities for research at each point in this shift toward primary healthcare. And through the digital health system, we expect that a useful data set will be available to support this research. As I mentioned, I work with our agency's digital development team. This team emerged from a forward-thinking partnership between two U.S. government agencies, MCC, my agency, and PEPFAR, who I'm sure most of you know, which works the U.S. government's HIV response worldwide. Through this partnership, starting in 2015, we experimented and documented and learned ways to use development funding to improve and develop digital ecosystems for health in African partner countries. One of our early investments was in the Tanzania Data Lab, which is also represented on today's agenda, as it has become a self-sustaining, highly considered center of achievement in data science and data use in Tanzania and East Africa. I wanted to flag their recent work on the 22 census in Tanzania, which in concert with the Bureau of Statistics is just one example of how data management and use can support government priorities and set the environment for research in demographics, health, and social services. Part of our investment in Lesotho, not coincidentally, will be a data and innovation hub focused on health data and modeled on the data lab in Tanzania. So we're taking the lessons that we learned from the work on the partnership with PEPFAR, and we're applying it to the mainstream work of poverty reduction. A good example is in Togo, where we're currently focused, which has a strong digital strategy and prioritized development of the digital ecosystem, including connectivity, but also digital public infrastructure, things like digital identification and interoperable digital payment systems. Developing these core digital services, along with data governance and support for innovation, will set the environment for data use across all sectors, including health. And we find that MCC's investments in strong digital and data ecosystems will provide actionable data for economic growth, as well as for long-term research. I'll stop there. Happy to take any questions when the time comes. We're certainly grateful for the continued work of NIH, DSI in Africa, and for the collaboration with all of you. Over to you, Obi.
Thank you so much, Mitch. And again, to everyone, please keep the questions coming in the chat. We'll have some time at the end for Q&A with the panel. Now I'd like to hand the floor over to my colleague, Laura Pavlich from NIH. Over to you.
Great. Thank you, Amit. Everything look okay?
It's loading. There it is. Yes, go ahead.
Okay, perfect. Thank you, Amit. Thanks everyone else for being here today. So I just have a very brief presentation on the National Institutes of Health. Like Amit said, I'm Laura Pavlich. I'm a program director at the Fogarty International Center at NIH, and I'm one of the coordinators for the DSI Africa program. Though I won't be talking about DSI Africa today since we don't currently have any open funding opportunities, but just wanted to make it clear to everyone that there are other places to potentially seek funding within the National Institutes of Health. So the NIH is a US government agency, really are the primary funder of biomedical and behavioral health research in the United States, but also we fund significant amount of research outside of the US as well. NIH consists of 27 different institutes and centers, so we're quite a large organization. Each of these institutes or centers focuses on a specific area of health or a specific disease area or kind of region of the human body. And so you can kind of take a look at the various institutes and centers and kind of figure out maybe where your research might fit. So the Fogarty International Center, where I work, we primarily focus on funding research in low and middle income countries. You may also be interested in the National Institute of Biomedical Imaging and Bioengineering, and then any of the other kind of institutes that focus on your specific disease area or area of research. Should mention that we also have an Office of the Director, which holds the Office of Data Science Strategy, and that office helps coordinate data science activities across NIH. There is interest in this space across all of the institutes and centers, and I would say there's also vast interest across NIH in global health research. When you apply to NIH, you actually apply to a specific funding opportunity, and it's your organization that applies, not an individual. And so there is a fairly complex electronic application process that one has to go through to submit an application. And it's just important to keep in mind that there does need to be that specific funding opportunity that the organization is applying to, and the research has to be relevant to one of the 27 institutes or centers at NIH. We have a nice kind of guide of how to apply on the NIH website, so I won't go through kind of the whole process here. We also have the NIH guide for grants and contracts where you can find specific active funding opportunities. These can be broad announcements that kind of accept research that could fit across all of the participating institutes and centers. And then there's also really specific funding opportunities on, say, specific disease areas or other kinds of research or research training. I think it's another nice resource at NIH is NIH Reporter, which is a searchable database of all of the awards that NIH funds. And it's a nice way to go and take a look at what institutes and centers are funding, where your research might fit, and also to find program officer contacts that maybe are interested in your work, whose email addresses actually can be found through the NIH Reporter system as well. Some things to keep in mind, like I mentioned, we do fund a lot of global health research and research in that awards, both in collaboration with and direct awards to foreign countries outside of the United States. But you have to also make sure that any funding opportunity you're interested in applying to is open to foreign organizations and that your organization is eligible to apply. So just note that in every funding opportunity, they'll have this eligibility criteria laid out, and you can see whether or not you're eligible for that opportunity. And just finally, I'll just add, since I'm coming from the Fogarty International Center and we do focus specifically on global health challenges, just want to mention that we have a funding newsletter and a Global Health Matters kind of bigger publication that you can subscribe to. The Global Health Funding news email that goes out weekly not only contains Fogarty funding opportunities, but global health opportunities from across NIH. So it's just a great way to kind of stay on top of opportunities that you might be interested in. And I'll end there. Thank you.
Thank you so much, Laura. There is a little bit of discussion in the chat about foreign applicants. Maybe you can comment directly there. So with that, I will hand it. Our next speaker is Amel Huila from the Bill and Melinda Gates Foundation. Amel, the floor is over to you.
Thanks, Emmett. Thanks, everyone. Let me just see if I can share my slides. Can you see my slides?
It's in PowerPoint mode right now.
Okay, cool. Here we go. So hi, everyone. My name is Amel Aguila. I'm a senior program officer sitting on the quantitative sciences team as part of the Global Health Division at the Bill and Melinda Gates Foundation. Apologies, I didn't include introductory slides. My slides are mostly about the Grand Challenges program, but I'll try to give a very, very brief overview. So the Bill and Melinda Gates Foundation is a philanthropic organization based in Seattle, Washington, in the United States, with presence in 8 different countries, including regional offices in Africa, Nigeria, Ethiopia, and South Africa. And the plan is to expand to 2 more countries in East Africa and West Africa, TBD. We do have different divisions spanning from global health, gender equality, global development, advocacy, and global advocacy. I didn't get the acronym right, but we have different divisions and about 41 program strategy teams. As I mentioned, I sit in the quantitative sciences team, which is basically a cross-functional team supporting different program strategy teams within global health, gender equality, and global development. And what we do is we basically focus on how do we enable data reuse to inform public health interventions and inform and guide decision-making on the ground, as well as product development and delivery services. So we really try to cover and fund programs that do sort of cover the entire data value chain. And the reason why my slides are all about the Grand Challenges program is that we do a lot of our work through the Grand Challenges program, which is one of the flagship programs of the Gates Foundation that is sort of a public-facing sort of request for proposals that do target different geographies, and we work with different program strategy teams on targeting specific strategies that they do have. So a little bit of background about the Grand Challenges, and there's a link in the bottom of this slide. It's grandchallenges.org. So Grand Challenges started with the idea of sourcing innovation from all over the world and targeting very well-defined roadblock to generate impact in the geographies we serve. And it started with very small programs, and the idea of the Grand Challenges program is that it's basically an easy application process in the sense that the majority of the applications are between 2 and 4 pages long, and it's an initial conversation between applicants and the foundation to explore big ideas and also fund sort of high risks project that end up being highly rewarding in most cases. So the way that the Grand Challenges operate is that we do engage with different partners on the ground to seed impact. And when I say we engage with different partners on the ground, I mean we work very closely with different countries' representatives or regional representatives, like Science for Africa Foundation, for example, is hosting Grand Challenges Africa. And so we work closely with our regional partners so that we establish a funding model that it's not necessarily just coming from the Bill and Melinda Gates Foundation, but it's in most cases a co-funding between governments and different organizations with the Gates Foundation. Like we're baking some of the challenges in partnership with our regional partners, but also with partners at the Wellcome Trust. So the GC model really helps engaging different innovators, helps mobilizing resources from different countries, and really help generating a sort of snowball effect where we connect partners in different regions. An example of that is one series of grant challenges around data sciences for maternal, newborn, and child health that was initially started in Brazil, leveraging wealth of administrative data in Brazil, and then got transferred to India and Africa. And we really focus a lot on how do we build these communities of practice and really help knowledge transfer across regions. I see Amit on the screen, so my time is up. Yeah, so this is just a map showing the different projects where we funded over the years, and in the last couple of years we've been shifting more towards funding proximal partners with a big focus on Africa, Southeast Asia. You can check the website grantchallenges.com. There are not any open funding opportunities right now, but we are baking at least 2-3 that are data and disease modeling related. So you're also welcome to sign up to the mailing list where you can receive updates about funding opportunities. And with that, I hand it back over to you, Amit. Thanks.
Thank you so much, Amal. That was really informative and helpful. We have one more presenter, Sam Oti, from representing both IDRC and the Lacuna Fund. So I'll hand it over to you, Sam. We're just seeing the PowerPoint version.
Can you see the PowerPoint? Let me see if I can take it to, how was that?
Yes, it's showing now. Go ahead.
It's fine?
Yes, go ahead.
But it's gone all the way to the end. All right, let me take it back to the front. So thank you. And hi, everyone. My name is Sam Oti. I am a senior program specialist with Canada's International Development Research Center. I sit in our regional office for Eastern and Southern Africa, which is based here in Nairobi. IDRC is a Canadian Crown corporation, or in a sense, parastatal, though we have a degree of independence from the Canadian government. We were established in 1970 by an act of parliament, and our mandate is to fund research in developing countries, for developing countries, by developing countries, on a variety of development issues. We have, for the first time in our history, a 10-year strategy. We've historically had 5-year strategies, but currently we have a new 10-year strategy from 2020 to 2030. It's on our website. I encourage you to take a look at it. And it really underscores our long-term commitment to working with researchers in the Global South to solve their own problems and challenges. We have our head office in Ottawa, and we have regional offices across the world, as you can see on the map. We have 5 programming areas. I sit in the Global Health Division. We also have an education and science program where much of our work on artificial intelligence for development sits, but we also have work on sustainable inclusive economies, climate resilient food systems, and democratic and inclusive governance. Of interest might be this programming that we have on artificial intelligence for global health. Our global health programming has 2 broad thematic areas on sexual, reproductive, and maternal health, and on epidemic, pandemic preparedness and response. And we're really keen on advancing research that will invest in developing and scaling responsible and inclusive AI innovations to address these 2 thematic areas. And as a result, we've set up a number of hubs. We have 4 artificial intelligence for sexual, reproductive, and maternal health innovation hubs. 1 in the Middle East and North Africa, another in Sub-Saharan Africa, 1 in Asia, and 1 in Latin America and the Caribbean. We have a global artificial intelligence for pandemic, epidemic preparedness and response, which is hosted at York University in Canada. We have 3 commercialization hubs that are really serving as incubators and accelerators for AI innovations for global health. There's 1 in Africa, again, 1 in Asia, and 1 in Latin America. Then we have, with support of the Global Health Network, we've set up a knowledge sharing hub for artificial intelligence for global health, as well as we're working with IDEA on advancing a gender responsive and inclusive AI across our portfolio of projects. This is the new hub, and that's the link, the knowledge sharing hub that has just been launched on our behalf and in partnership with the Global Health Network. I encourage you to take a look and see what's going on there. The projects, a lot of the hubs are still relatively new, so there's not a lot of content just yet. So it continues to be a work in progress. I talked about our Artificial Intelligence for Development program, which is led by our Education and Science initiative. They've also set up a number of innovation hubs on gender, on agriculture, on education, etc., across the globe. And then we are also one of the funders of the Lacuna Fund, which is really looking at how we can invest in generating equitable and inclusive big data sets to which we can apply machine learning and AI too. And so the purpose of the Lacuna Fund is to really support the creation, expansion, and maintenance of data sets that are equitably labeled and can support the application of ML and AI in the developing world. And how the fund is doing this is by disbursing grants to institutions to either create new data sets or expand and maintain new data sets that fill important gaps, and to make it possible for underserved populations to take advantage of AI, right? And currently we've already run through the Lacuna Fund's 2 calls for proposals focused on agriculture and language. 16 projects received funding, 10 for language and 6 for agriculture. It was a $2 million portfolio, and they're currently concluding their projects. And currently on the Lacuna Fund website, there are 13 data sets that have been published and are openly accessible on agriculture and language. And in the second round of funding, we've selected an additional 42 projects to receive about $8 million. And this cuts across agriculture, language, health, and climate. And there are currently 2 open calls for proposals on climate and forests, and on sexual, reproductive, and maternal health and rights. I think the deadlines are in the next couple of weeks. So please feel free to go to the website if this is of interest. And some examples, and I think this is my last slide, second last slide, examples of some of the outputs from the Lacuna Fund include this data set on language that has been developed in Kenya by a group known as Ken Corpus. And it has been downloaded 250,000 times, which is pretty amazing. And then we also have this agriculture data set that was developed by the CGIAR and Zindi, and really looking at what they call crop cut yield estimation data sets. I'm sorry, I'm not an ag expert, but apparently this is really a good thing. So these are some of the funders: Rockefeller, Google, IDRC, and a whole host of others, including Wellcome, who's represented here today. And these are my contact details. Feel free to reach out to me. Thank you.
Thank you so much, Sam. And thank you to all of our panelists. I know that we're at the time we agreed, if the panelists are able to stay for just another few minutes, we welcome any questions for the group. And maybe I can ask all the panelists, if you don't mind, to turn on your camera just for the last few minutes. There is one question from Cynthia Sung. What is the typical funding amount that your organization gives per health data science grant? And I wonder if that's something that whoever would like to share. I think Cynthia is looking for a little bit of scope. Ivana, go ahead.
Yeah, I can share. So specifically around data insights, grants range from $200,000 to $400,000. And then other RFAs are different. So some of them don't have a cap, and then there's another. So metabolism RFA that is currently open is up to $500,000.
There's naturally going to be a wide range with this type of question, but would anyone else like to answer about any specific programs? Just to give the audience a sense of the scope.
I'll jump in, but I suspect this is unhelpful. We have made grants that range in size from, I think the smallest to date is probably 80 grand, and the largest to date is about 30 million to one group. And it really depends on how much folks are asking for and what. We tend, especially in our team, to not do as many open calls. It's more strategic discretionary funding where we've identified a gap So we spend a lot of time doing landscaping in partnership with the academic community. And once we've identified a gap, then thinking about who the right partners are. And only when we think there is space for, I think, an injection of innovation into the ecosystem would we think about doing a call rather than picking someone that we think is uniquely placed to address the challenge. It also allows us to put our hands on the scale as we're thinking about equity and diversity and inclusion and who gets a grant, because institutional structures aren't perfect.
Thank you. There have been a few questions about how to contact individuals. And so I think some of you have shared your information. Some of you have shared a general email and the address that goes to groups of people. And for the whole audience, we're planning to share a contact list after this meeting with some of those contact emails. So for the audience, including some of the people in the audience who've agreed to share their information. So that will be on the website, and you see that there will be a link on the Virtual Networking Exchange website, but we'll be sending an email with some contact information. One other question, people are asking about funding opportunities that are available in their specific country. So maybe a general question, how do people find out what funding they're eligible for if they're in Ghana or Nigeria or another country? What's your advice on how people can navigate your organizations to find out what's available to them in their countries? Would anyone like to comment?
I could go first. For IDRC, we are generally country agnostic in the sense that our mandate is in LMICs. So generally, if you're in any country in an LMIC, you would be eligible. However, there are in certain cases, some calls are restricted to certain geographies. So it might be Eastern Africa or Western Africa or Asia, and that will be made clear in the call. And in some cases, we have, again, because we are affiliated with the Canadian government, there are certain countries that are considered high risk, and it's not like we'll not fund those countries, but it would be subject to some additional due diligence just to make sure that we can effectively transfer funds to the partners in those countries.
Yeah, thank you, Sam. Amel, go ahead.
Yeah, just to briefly add, it's the same for the RFPs that are open through grant challenges. It's in general mentioned in the RFP which geographies we're targeting, and we do also specify how much funding should be going to those geographies. Like, for example, some of our calls have been targeting Africa in general, like anyone based in any African institution can apply, with some restrictions, like, for example, 80% of the funding should go to an African institution. Then people can have collaborators in India, in the US, in Europe, etc. But there are, in general, it's very specified in the call.
Ivana, go ahead.
Yeah, I would also like to add that in general, CZI funding is open worldwide, and we do actually extensive outreach to institutions in Africa and Global South, and welcome and invite applications from these regions.
Okay, thank you. Mitch or Laura or Caxton, would you like to just briefly comment on this?
Yeah, I mean, sorry, go ahead.
Please go ahead, Laura.
I mean, similar to what was said earlier, for the Fogarty International Center and at NIH, we focus on low and middle income countries. So that applies globally to any lower middle income country as defined by the World Bank. But then for other NIH institutes or centers, you would look through that foreign eligibility section. And typically, if foreign is eligible, that would mean any country outside the United States.
Over to Caxton.
Yes, so for the Science for Africa Foundation, we have a granting model where we work really closely with some of our funders as well. So Gates Foundation, welcome, also represented here. We work really closely to identify gaps that we want to address. But our focus is specifically in Africa. We've tried really hard to focus on all the countries in Africa. Still not there yet, but what we do is through our website, we do post our call for applications, requests for proposals with specific, criteria, eligibility criteria in terms of what, defines who can apply and who can engage. We do have consortium models as well, where we encourage hub and spoke model for partners who are very well capacitated. We work closely with partners who are more or less nascent. So we do encourage collaboration in that sense, where we can ensure that granting can reach to the up and coming research institutions as well as organizations in the continent. Over.
Thank you, Caxton. Mitch, over to you.
Yeah, very briefly, MCC is a little different. Our work is very country by country. In fact, the funds are transferred to a particular partner country to do the procurement. So any grants or research that's done would be done by the African country in question. And those are always done through public procurements. So it's just a question of searching.
Maybe to try to summarize, I think every funding organization is a little bit different. Every funding opportunity is a little bit different. There have been some questions about specific areas, and I think the takeaway message is to really encourage people to go to the websites, find a contact, and learn more about what funding opportunities are available, what fits, but also create some dialogue with the program officer or the person who's in charge of that funding opportunity, and kind of take it from there. So I think some of the questions that are in the chat, I think, are a little bit harder to respond to, and we're also unfortunately out of time. So I just wanted to kind of wrap things up and just say a huge thank you to all of our funding organization partners for being part of this event and for sharing your information. For anyone in the audience, we do have information about each organization on the website, and we'll try to get everyone's slides also added to the website, so that you can see, get some of those links that you were interested in. So let me just say again, thank you so much, everyone, for being a part of the panel today. Really appreciate your time and involvement. And I think that the questions will continue, and hopefully we'll make some connections after the meeting to get to those answers. Finally, for everyone who participated today, I want to encourage you to please fill out the survey. Francis has just put the link in the chat. This type of a networking event is sort of an experiment. We're trying different models out, and I know some things went well today and some things we can improve upon for the future. So please take a few minutes and fill out that survey and give us some feedback on how we can make this a better event in the future. We do hope to have an event again in a few months or so. We will be sharing information on the organizations that participated, as well as recordings of some of the breakout sessions in case you want to follow up and learn more about something that you missed. Very last word is just to also huge thank you to Francis Agama for the DSI Africa Coordinating Center and all of the facilitators who volunteered their time today to help manage the flow of, I think we had more than 300 people join today. So really big thank you to Francis and the team at the Coordinating Center. Thank you so much for your hard work today. Thank you all participants for being here today. I really enjoyed meeting many of you, and we hope to see you again in a few months. So thanks, everyone. Virtual round of applause for everyone, and have a good rest of your day and your week.
Thanks. Bye-bye.